And there is a sense of anti-urbanist wave which is emerging. This was also seen in context of India, where many of the migrant workers fled from the urban areas to the rural areas once the lockdown was announced. For many of us, especially young people who have been relegated to the lockdown scenario, loneliness, depression, and many things have become common. Hunger, sleeplessness, and exploitation of the urban poor is something that has been prevalent in most developing countries, and it's also seen in many of the developed countries. This is something that also shows that the urban infrastructure is still not perfect in our scenario. The transportation is not up to the mark. The health services have been left in tattered, and there has been a shortage of basic services to the urban poor. Lockdown is definitely changing urban dynamics. One good part that we had seen was that environment was bouncing back. In many of the places, we could see that the river water became cleaner. People in India, for example, were able to see Himalayas from their cities. In many of the cities in Canada, one could see bears, moose, and elks walking on street. This was also seen in Alaska. In certain cities in the global south, certain coastal cities, turtles had come. So this is something which is really unique to see, and it has been a kind of an opportunity of our lifetime that the environment did not take much time to bounce back. So does it really say about the management process that we had been following in our urban areas? Is it really time to rethink about it? Cities like Bogota, Berlin, and Mexico are expanding pedestrianization in many of those cities. And in many of the cities in the world in general, we find that public transport systems have been getting affected because of excessive closeness to each other that people have. So, is it really time to rethink about these scenarios? What we've seen is that the development has simply not followed the Rostov's model of economic development. So, in a way, what has happened is that these countries have transitioned from agrarian countries, or these countries are transitioning from predominantly agrarian societies to tertiary societies, unlike China, which had a robust secondary sector. So, if and when the tertiary sector becomes the mainstream sector of our economy, there are chances that the supply chain distribution system might become more decentralized. So, how are urban local bodies going to prepare itself is something that we still need to know. Value additions in goods and services is definitely going to happen. Intelligent public transportation system is something that we might still be willing to accept as individuals. Tesla is working on driverless cars. Uber is working on driverless cars. These kind of developments are right now in their juvenile stages, but maybe in a decade or half, it might become mainstream. It might also happen that once these developments become mainstream, many of the countries which are still developing but want to enhance their productivity might be willing to buy these technologies. So, what happens when this kind of technology uh, comes into the cities of the global south? Definitely, intelligent transport, public transport system is going to enhance efficiency. It's going to enhance our safety, security. But is it really worth it? Or is there any way that it can be mainstreamed in a more inclusive manner is something that we all have to definitely consider. Updated public safety protocols is another concern that we might face. What it means is that it might happen that cross culturally across the world, governments might legislate the way public should behave when they are outside of their homes. So it should start. Apparently, what's being predicted is that it might start off with a simple saying that social distancing should be normalized. And then the definition of social distancing would become more inclusive and comprehensive. And it might happen that governments might legislate as to how we as people have to walk on streets or behave in on streets or in neighborhoods. Whether this is going to be a good development or uh, uh, I would say, uh, dictatorial kind of development is something that we still need to find out. But this is something that might come. Development of small towns and modernization of rural areas is imminent because of excessive migration into mega cities and metropolitan cities. The pressure on mega cities and metropolitan cities has been increasing, and often, as was seen in the context of India and United States as well, for example, uh, it was the excessive population, the excessive density that these big cities have has created the problem that we see. Precisely, I would argue that it's not excessive density, but because of excessive density, the provision of basic infrastructure has not been in the proper fashion. That's been the cause. So apparently, it may happen that the focus might shift to the development of small towns and rural towns, and that too, it might include information communication and technology. Smart cities is a big word these days. The definition of smart cities is varying from one country to another country, but overall, the common theme that we see in most of the countries is that they do make use of information communication and technology. So we are entering into the age of database economy, and this is something that might change the face of human settlements for a foreseeable period of time. So urban areas, especially the small towns and rural towns, can get modernized, and they would get modernized. And if ICT is being in place in a very robust manner, uh, things might turn out in the desired fashion. There's also going to be change in design and construction methods. This is something that's not a new thing. The concrete material that we have seen in most global cities, ranging from New York to Shanghai to Mumbai, is entirely a new phenomenon, in my opinion. It's a phenomenon which has been in existence since last 100 years or 120 years at the most. But if we look into the history of settlements, the construction techniques that each and every settlement had differed from place to place, and that was very localized. So a settlement that was seen in a very high altitude had a different kind of architecture, different raw materials, vis-a-vis the settlement that was seen across coastal areas. So it might happen that we might once again revert back to conventional construction styles, although not conventional per se, that we would definitely not regress, but we might adopt more eco-friendly construction styles. For example, in context of Canada, the construction using timber is on the mainstream. So timber could be normalized here. The similar thing could be seen in the cities of which are lying close to the coastal areas. So these are certain interesting developments that might happen. Whether it turns out the way we want or whether it goes in a different direction is something that we all researchers, professionals, and policymakers have to think about and work towards. So here, at present, I would be discussing about existing measures that are being taken up by certain governments. And we might see certain commonalities that has enabled them to contain this pandemic. So across the news, we might hear that Singapore has been performing exceptionally well. Taiwan has been performing exceptionally well. Hong Kong has been performing exceptionally well. And to some extent, Canada has been performing pretty well as well. So how these countries have been able to contain this contagious virus is something that we might explore. So, in the case of Hong Kong and Singapore, early preparedness was something that enabled these governments to limit this virus. So, if we remember, back in 2002, there was an epidemic that had devastated most of us. And I think by that time, at that time, most of us had been teenagers, but we used to hear it in the news that there is something which is called SARS, and SARS is infecting every one of us. So we need to be prepared. So Singapore, Hong Kong were one of those countries that were worst affected. If not worst, then highly affected. But SARS enabled them to have a system based on the experience of SARS. They were able to learn and apply that learning, and they were able to prepare for the future. So it enabled them to develop a system that could handle similar disease if it happened in future pretty effectively. So they came up with public health response and monitoring system, and this enabled them to handle COVID-19 effectively, given the fact that COVID-19 itself is a kind of SARS. It itself is a kind of a virus, and SARS is a virus. So the response system enabled these countries to better able to kind of like uh, uh, more effectively manage these this kind of pandemic. So they strictly put fines on violators. Apparently, what was seen in context of India, despite uh, great efforts taken by government, the violators were being beaten up. Uh, in the eyes of the Human Rights Commission, this could tantamount to human rights violations as well. So I'm not saying that violators should not be punished, but then there could be other enforcement measures that makes sure that they comply. So, given their own context, given their own economic base, uh, I felt that strict fines for them was something that helped them to effectively tackle this pandemic. So, what happens basically is that those people who have been identified with COVID, they receive a message that because you have been identified with COVID symptoms, you need to stay at home. You need to quarantine yourself. So they get they get these text messages regularly, and they have to keep themselves in quarantine. GPS technology enables them to make sure that they are inside, because the government, the local authorities are able to track their movements through GPS technology. At the same time, they get random phone calls from the authorities to confirm their availability, whether they are actually in the quarantine phase or not. So, this is something that has really helped the government of Singapore. And what happens thereupon is that people are supposed to click photos and uh, kind of corroborate with the government that the place that they are in right now is their own place where they have been quarantined. So this enables them to contain themselves. So in a way, it ensures transparency and it is an accountable method also. And if, for example, a person is seen violating these norms, they are paid to, they are subject to strict fines and penalties. Because of this, the mortality rates in Hong Kong is seen as 0.003% as on date, and in Singapore it's been 0.00083%, which is a very good percentage. Ideally, it should have been 0%, but close to zero is a good percentage. Another example that we see is Taiwan. Now, Taiwan is a small country which is located just adjacent to China. The good part about Taiwan is that the so called democracy exists in Taiwan. And that's a good case study for the for the countries of the global south, including India, Bangladesh, Pakistan, Bhutan, Nepal, etc., to emulate. Definitely the scale is different. So, unlike China, where the virus was contained at the cost of the human dignity of the denizens, China had a different, Taiwan had a different approach. So, it had been able to prepare itself post SARS 2002 scenario, and they were able to efficiently and effectively isolate people. What they had done was they put tight control on international travel. This is something that was seen in case of India, but then things were not able to get executed properly, that we suddenly saw increase in the number of cases. Taiwan was on However, apparently, Taiwan was able to execute it in the way it was supposed to be. So, contact identification was one strategy that they had used, and they had a relational database management system where the health database was being used in the right way. So, what they had done was that they tried to merge the travel history of the person with the health insurance of the person. And in that way, they were able to contain the virus. So, if a person had been coming from a country, for example, China, if the person came from Shanghai, uh, the person was tracked, his health insurance was seen, and he was put to quarantine. Universal health coverage is an important feature of Taiwan, where people are insured in terms of their health. They were able to stockpile N95 masks uh, uh, in early stages, and this was something that really helped them minimize the impact of this virus. Another important strategy that they could use was that they started providing temperature measurement bands to people. So what would happen was that a person would would wear a temperature measurement band, and a person would, wherever the person would go, in a span of 24 hours to different places, if the person had to go, they would have to measure their temperature. And the measurement of their body temperature was directly related to the health database. And in case of any COVID symptoms, the person was tracked upon, and then the person was put in quarantine. So this was something that they were able to effectively execute. And as a result, they were able to contain this pandemic. So, as on date, the mortality rate is 0.01%. Again, it is not 0%. Had the mortality rate been 0%, that would have been the best scenario, but they are close to 0%, which is really a good initiative. Canada is a very big country. It's in North America, and it's a very cold country. The number of cases in Canada had been increasing, but then the government had a different approach. What the government did was they did not put the country on a severe, massive lockdown. Essential services were running, retail stores were running, but the government provided incentives for people to stay at home. So they provided $2,000 per person per month for up to 4 months in case of layoff, and citizens of Canada were eligible for it. Permanent residents were eligible for it, and even students were eligible for such kind of scholarships. So this was something that was really helpful because the government was able to provide the citizens, incentivize the citizens to stay at home. At the same time, it's also the responsibility of citizens to stay at home. So this is how they were able to, the local body was able to manage the virus. At the same time, public transport system is, and maybe for another week would be running free. They have alternative seating arrangements, though the frequency has been reduced. Coverage is for everyone in Canada. If you are coming to Canada, you have to have that health coverage. So if in case you are falling ill, the government will take care of it. So these are the basic necessities that the governments have to adopt. These are the basic services that the government have to provide. We might have, many of us might have learnt about the Maslow's hierarchy of basic needs. So it starts with lower level needs, then middle level needs, and then higher level needs. So what happens is the role of government becomes really important in the provision of basic needs. So things like food, shelter, health, education is something that the government is and should be bound to provide. Countries like Canada, Taiwan, Singapore, or maybe Hong Kong, for example, to a great extent have been able to provide these basic services to their citizens. And it's no wonder that a country like Canada has a mortality rate of 0.07% as on date. Unlike other countries, Canada is being able to contain this virus without inflicting upon the dignity of the residents. Canada is able to contain this virus without punishing the residents. But again, these are the short term measures that are being taken up. But definitely, there is a way to learn from them and a way to emulate. Digital democracy is another concept that is emerging, and urban local bodies are trying to adopt this concept. This is happening in the UK and in the cities in Japan and Korea. So it enhances effectiveness, and it is created when distributed groups of people work together with the help of technology to mobilize more information, ideas, and insights to solve a problem. So what happens is that this is a kind of technology that relies upon machine learning techniques. We recently saw that Orissa, the state of Orissa in India, was badly affected with the natural disaster. And the other day, I was venturing on to the Facebook, and I could see people marking themselves safe. That yes, I am safe during this disaster. Yes, I am safe during this disaster. So, in a way, that could show that a person who was living nearby was safe. At the same time, it could also show how many people who were living in those areas were getting affected. Now, suppose if we have that kind of system, that kind of app that enables us to show our existing whereabouts, and if we are traveling from one place to another, then through machine learning techniques, we can predict as to where this particular pandemic would venture into future. So this is how they were able to predict this COVID pandemic from Wuhan to Japan, for example, or to different country. And in this way, collective intelligence is a highly effective technology that aids human intelligence, or I would say that makes use of human intelligence and could lead to more precise results. Certain examples are iGeolyze, King's College London's reporting app, and to a great extent, these technologies are being used in an efficient way. This is something that we need to think about in the near future. Artificial intelligence is here to come. Now, artificial intelligence is a very big concept, and it is beyond our, as urban planners, as scientists, it is beyond our scope to define what artificial intelligence is. But what we must know is that the techniques used by artificial intelligence are definitely going to be adopted in the governments of Europe, America, and Asia. So, this is a technology that is here to stay. And especially the governments might rely on narrow artificial intelligence to solve our problems. So, database gathering and mapping is an important feature upon which this artificial intelligence technique works upon. And we are entering into the age of database knowledge economy. So, this is something that is going to stay with us. And this is something that is being applied pretty effectively in many of those places. Across different countries, this, in my opinion, has been the most important effort. The urban local bodies had it the urban local body is limited in its own way. But we are also seeing the age of participatory democracy. In India, for example, the 74th Constitution Amendment Act talks about decentralization, and it talks about the governance at the grassroots level. So, what happens and what we have been seeing is that in order to contain these pandemics, people themselves have come and offered help. And this is something that the government has really appreciated. The local bodies have really found it helpful. So, volunteer efforts of denizens across the world is a very noble phenomenon, and this is something that would definitely stay with us. And uh, if things go in the right direction, we might eventually enter into the phase of participatory democracy. In fact, we are entering in the phase of participatory democracy, wherein the people in general, public, are coming and managing their urban local affairs. So, this in a way is helping the urban local bodies also. Focus is on pedestrianization, be it Bogota, be it uh, Mexico City. So, a new concept is emerging, which is 15-minute walk, 15-minute city. So, basically, human beings require certain services in order to lead a wonderful life in urban areas. What if those services, what if those landmarks are within vicinity, are within 15 minutes of walking distance? How would our world be? This is something that is definitely going to be adopted in many of the cities, especially cities that have got area or cities that are willing to uh, kind of uh, uh, use their space more effectively. Adaptive reuse, as we discussed earlier, is again something that is going to become mainstream. If we have a school, a space like a school, a public space as a school might be used as a school during morning and afternoon hours, but it could be used into, but it could be put to use in different use after afternoon hours, for example, maybe during the evening time. So again, this is something which we might be willing to trade off in the right way. So what we see from these existing measures is that learning from similar experiences really help. Countries like Taiwan or Singapore or Hong Kong, for example, were able to learn from their previous experience. They were able to leverage their learnings from SARS 2002 epidemic, and they were able to prepare themselves in a way that helped them to contain this pandemic. Robust health infrastructure is a very important component. Cross culturally, those countries and cities in particular that had robust health infrastructure were able to contain this pandemic. Had it not been there, this pandemic would have spread. Early resource identification and efficient utilization was another important factor that we could learn. Database upgradation is another thing. Data oriented measures, for example, collective intelligence, is really helpful. Inclusive development, development of different sections of society, which includes minorities, LGBTQ community, women, children, seniors. Development should be inclusive, and the countries and cities in particular, which have been able to perform well, have predominantly relied on these measures. Economic resilience is another aspect that needs to be explored, and this is what we could learn from our previous example. And localized urban planning with concepts like 15-minute walk, 15-minute city, things like that. But we need to remember that early bird catches the worm. So if you are able to prepare early, we are able to manage this disease early in the right fashion. How is our world going to look like? This is a very big question. At this outset, whatever policies and procedures that we might adopt or look forward to explore, we need to keep in mind that it adheres to certain goals. Paris Agreement is one such internationally agreed framework. Sustainable development goals is something that we need to consider definitely in our future course of action. New Urban Agenda, which talks about zero carbon emission by 2050, is definitely that would help us in formulating the right kind of policy. So, Paris Agreement uh, talks about the reduction, 2% reduction in carbon emissions. Sustainable Development Goals are 17 of it. There are 17 of the Sustainable Development Goals, which talks about different facades of improvement, and subsequent policies should be able to uh, take the provisions of these agreements and these goals and be able to apply effectively in their own country, in their own way uh, possible. So, these are certain transformational aspects of urban management that we might venture upon based on the learning from the existing best practices and based on few guiding frameworks such as Paris Agreement, Sustainable Development Goals, New Urban Agenda, and similar frameworks. We need to keep in mind that Sustainable Development Goals in itself, this goal in itself is a very comprehensive goal, and most of the aspects have already been taken care of. So, if we are able to successfully implement it, or if we are able to successfully uh, uh, create policies, management policies, then we might be able to contain this virus. So, if and once the management policies are created, planning and management policies are created, the planning and management would become a lot more easier. So, what could those techniques be? The first and the foremost is that we need to be able to generate more actionable data, which means that we need to have an integrated public health monitoring and response system, the way cities have the success stories have been able to perform, for example, Hong Kong and Singapore. So, for the countries of the global south, this particular things becomes more pronounced. Rather than investing on big statues and big bridges and big buildings. In my opinion, if more infrastructure is, if more finance is allocated to a better health system, that would really have a very positive result. So, on similar lines, the way Taiwan has been able to do, the way Singapore or Hong Kong has been able to do, uh, uh, we feel that cities of the global south, including New Delhi, Mumbai, cities in Pakistan, Bhutan, Nepal, I believe they would be able to go in that direction as well. But what's more important to understand is that the urban local bodies themselves are not financially rich. So the government has to have an important role to play, especially federal government, to assist these local bodies financially. At the same time, these urban local bodies have to evolve their own resource generation model. In case of India, Hyderabad is an important model to emulate. Maybe Ahmedabad is an important model to emulate as well. Similarly, investing in cities as system, which involves focusing on giving cities the support, which is technical support, and resources, which is data, to create integrated social and economic infrastructure strategies at grassroots. In context of Canada, every person has got social insurance number. So once a person enters Canada, they are assigned a number which is called social insurance number. And wherever the person is going, that social insurance number is helping the government create a robust database. On similar lines, this is something that we see in India as well. We have Aadhaar number. So the person is able to use their Aadhaar number and be able to provide their information in the localized database. It is important to understand that there are breaches in the database systems. Cybercrime is something that is happening and it is bound to increase. So, local governments and national governments have an important role in protecting the data and the privacy of their citizens. They should not be trading their data with private companies, for example. So, if and when these initiatives are considered such that the dignity of person is ensured, the privacy concerns of person of an individual is being ensured, then uh, these kind of initiatives might have a fruitful impact. Then we also need to talk about building economic resilience. Informal sector workers are the backbone of our economy. This is true in case of the countries of the global south, including India, Pakistan. What was seen in India, unfortunately, despite the sincere efforts taken by the government, unfortunately, in certain instances, it was seen that people who were engaged in informal sector were the ones the who were the most vulnerable. They were the most worst hit victims. So it is important that the government develops certain approaches that safeguards their well-being. Uber drivers, for example, do not have any insurance. They do not have any formal contract. So in cases of pandemics like these are the people who become most vulnerable. So what if we have basic financial assistance to each and every one of these people? Can that be a fruitful initiative? This is something that we need to think about. Of course, certain people and certain individuals might definitely be successful in finding loopholes in these kind of assistance. But then the purpose is to help people and make sure that the most vulnerable is able to survive. And if and when the person is financially empowered, then many of the issues are settled, if not all the issues. It was seen in countries like India that the vulnerable sector, the people who were there in the informal sector were worst hit. So the urban local bodies need to make sure that whatever initiatives they are taking has to take their concerns as well. These are the short-term initiatives which, in my opinion, I think should be able to help them. I was also talking about. We also discussed about the 15-minute city. So this is a concept which is being developed by Professor Moreno, and countries like France, New Zealand are planning to develop their cities by 2024 that are adhering to this concept. So there are certain things that make an urbanite happy. These things are dwelling in dignity, working in proper conditions, being able to gain provisions, well-being, education, and leisure. So if and when these certain six things are provided to people in a very reduced radius, then the urban life becomes more fruitful. So, what if we incorporate this kind of planning into our planning and design process? Whether it is applicable to the cities which have existing dense settlements or not is something that we as people have to decide. And this is where the importance of participatory democracy comes into place. What if people themselves have uh, what if people themselves have uh, say in decision making process? So that should be able to help them out. Then transformational aspects, these are the targets of 5 to 10 years, which is like ensuring basic services to all. Health, education, and basic services do take time, unlike a construction of a statue or a bullet train. So this is something that needs to be provided. And the long-term things could be mainstreaming food security in urban planning. So the people who are governing the urban affairs need to make sure that food security gets mainstream, integrating public health in urban planning, mainstreaming technology in urban planning, building a circular economy, inclusive development, universal basic income, social distancing norms, strengthening tech-related small business, public participation in decision making. It is important at this outset, to see how mainstreaming public health can be helpful. Basic planning and legislative standards to avoid risk to health. Planning codes to limit environment that detract healthy lifestyle. Special framework to enable healthier lifestyles, and enabling urban and territorial processes to capture multiple co-benefits of building in health. So, if we look forward to the urban management, mainstreaming of these aspects within the next coming decades would really be fruitful. These are the suggested readings that the researcher and the audience might be interested in, and this is something that they should definitely venture into. Uh, with this, I'm just going to say that in the context of the global south, there is not going to be a single blanket approach to solving these issues. We need to see the individual scenario, and a piecemeal approach should be a better solution to these aspects. With this, I would thank you, all of you, and I would like you all to stay safe. And thank you, Archiloop India Initiative, including Mr. Pranay, today Mr. Shashank Shekhar, and Ms. Aditi for inviting me over. It's been a wonderful uh, opportunity for me. Thank you all.
Thank you, Mr. Jha, for such a wonderful presentation. Hello.
Hello.
Hello. Hello. Am I audible to you guys?
Yes, yes, Shashank. You are.
Yeah. Thank you, Mr. Jha, for such a wonderful presentation. As I have already mentioned in the chat box, all the participants can go ahead with their questions. Meanwhile, I would like to conclude today's session. I strongly believe that cities shape cities, and some of the most iconic development in urban planning and management, such as um London Metropolitan, Board of Works and mid-19th century sanitation systems develop a responsive public health crisis such as cholera outbreaks. Also, Mr. Jha has nicely outlined the pro and cons of this pandemic. He also took the various measures that some of the leading cities such as Hong Kong, Taiwan, uh, and Singapore practiced during the COVID-19 has been successful in the containing the spread in urban markets. I hope participants will enjoy
Uh,
and find this discussion
uh,
useful for planning and reshaping the cities and become more resilient and sensitive towards the environment. Uh, while we have received some of the questions from our fellow participants, we request Mr. Jha to address them. Our first question is our first question from Mr. From Rohini. Yeah, I have forwarded the question to Mr. Kanad. Kindly answer the first question. Hello,
Yeah, I'm trying to look into the question.
yeah.
Uh, is it possible that you just kind of like read that question, because somehow because of the technical difficulty I'm not able to see the question bar.
can we just ask questions on the mic directly?
Yes,
That
we
should
can.
be helpful.
Okay, I'll let
Kindly introduce
whoever came
yourself.
first.
Kindly introduce yourself.
Sure. No, I don't want to step in. I just want to let whoever put in the first question pose that question, please, on the microphone so that everyone can hear.
Yes, you are audible.
Okay, I guess. Um, if I can go ahead, I think this was a great discussion. Again, thank you to Archiloop for hosting or organizing this webinar, and kind of pretty detailed discussion on what's been the impact and what's going on. I do have some questions and comments. I think which will hopefully we'll all get to discuss together, and this would be an interactive session. Do you would you mind pulling up the presentation so that
Yeah, sure.
we can talk to some interesting bullet points that you had mentioned?
Sure, definitely.
So I think going back all the way to the beginning, maybe slide 2 or 3, was a very intriguing bullet point that you put forth, which was, yeah, right there, right here.
Right.
So I think you talked, about changes in daily life in urban areas and how it's affecting us. And some of these have been, captured here well, depression and hunger, sleeplessness. This is all, at the level of each individual's experience during this pandemic time. But two of the points are actually the first bullet point, cities becoming redundant. I wanted to understand what that is really talking about. Is that are we thinking that cities will no longer be as, you know uh, flourishing and as growing and as rapidly, attracting population as they were before, or what was your intention, or the basis of this statement?
Yeah. So thank you, Mr. Tallim, for asking this question. So this was basically a prediction that was done by one of the researchers at LSE, and what they meant by cities becoming redundant was the fact that people, especially the working class, was migrating from urban areas to rural areas. So, if and when the working class with families migrate from urban areas to rural areas, then the economy goes into a different direction. And that's what they tried to talk about. That's what they tried to point when they meant cities becoming redundant, because the multiplier effect is seen everywhere. So a family has more decisions in the market than a single person, because family needs more resources to survive as compared to a single individual. So when families migrate to rural areas, this is what they have prognosticated, then a multiplier effect would happen. And in that way, the cities would become redundant, because the economy that the cities have been contributing to, the gross domestic product that the cities have been contributing to, might change or might become diversified.
Okay, I think that that's fair to say that when citizens or people living in cities go to suburban or rural areas, naturally that makes the cities less redundant and reduces the GDP. But I'm not sure if that's quite related to the pandemic, phase that we are experiencing here. That thing happens despite of even if there is no pandemic. I guess there is migration from cities to suburban areas, and it's also interesting that a lot of these resources that we talk about for families to take advantage from all these resources are made available in the cities. So it's a little bit, I would say, contradictory to the fact that people migrate to cities, and we are seeing more and more migration here. I know there's we are not. I wish there was some data here that we had seen on migration, but see, people are migrating to the cities more and more each and every day. So going back to the rural areas, I don't see if what the motivation for them to go back to rural areas would be. But anyway, that migration
Yeah,
discussion, I guess that's. I was just wondering how that is connected to the pandemic itself.
yeah.
But
So
fair
I would
point.
just like to answer you here. If you see the data actually corroborates this statement. In case of India, for example, pandemic has exacerbated this situation. You might have seen many migrant laborers have actually migrated from cities like Mumbai, Delhi, into smaller towns and rural areas. So when we talk about cities becoming redundant, in the context of pandemic, the data is corroborating it, and pandemic actually has to some extent been able to exacerbate the situation. Yeah.
Okay. Okay. That's good. I was also one of the biggest things I guess in this discussion that we can all agree to is the pandemic is going to stay for a while, but there is going to be a point where um, a vaccine is going to be developed. That's one of the biggest that the entire is working to develop a vaccine and get pretty much full herd immunity to the pandemic, to COVID-19, not only this pandemic. So once it's I think important to acknowledge that once that vaccine gets developed, things can definitely go back to normal. There's of course going to be resiliency measures that you talked about that cities are going to have to put in place, such as one of the biggest things that you mentioned is data collection and tracking of contact tracing that all these a lot of these advanced cities are doing. But it is good to know, or it is, I guess, critical to understand that once that vaccine gets developed, which I think, according to some Morgan Stanley studies and research, it may come in be widely available by the end of 2020, or maybe that's too soon, mid 2021. But that's something I wanted to just put out there, that we can, the long term effects of this pandemic is kind of hard to predict, because once the vaccine is available, that all these drastic measures for lockdown and social distancing may not be even required because the world will start to get immune to this. Um, the other
So
question I had on retrofitting, I think that was pretty cool to see some kind of physical solution. I think the example that you gave was of a school being converted to something else. Was that? Can you elaborate a little bit on that? Like, what can we use that type of infrastructure for? What can it be retrofitted with?
yeah. So I would like to answer both these questions. Yeah. So today, basically, before this presentation, I was reading this newspaper called the National Post. So each and every country and different institutions, starting from University of Oxford to companies in China, are trying to develop these vaccines, and it might take 1.5 years for the vaccine to become mainstream. So if and when this situation happens, uh, it might lead to a different scenario. Definitely, we need to keep in mind that when we are saying that the cities are going to evolve, it doesn't mean that everything which is seen existing is going to change. These are prognostications, these are predictions that things might change. So, AI, for example, or contactless transactions could become normalized. So, we always need to keep in mind that not 100% things which are seen at present is going to change. It's not a total 180-degree turn. So this is something that I would like to point out. The second thing is when we talk about retrofitting, we might consider using buildings in different ways. For example, this could be true in term. I gave an analogy of schools. We are seeing in cities like New York, which has been in cities like
One is not muted.
in cities like New York or Singapore, in order to keep people in quarantine, uh, hotels are being used. Similarly, in cities like New Delhi, in order to keep people in quarantine, schools are used. So, by talking about different use of a single building for different purposes, uh, I want to take this discussion or maybe thought in a different direction. For example, we might have a school where people are which people are using during the morning hours for study purpose. That same school could be used for adult education during evening, or maybe for yoga during evening time, or maybe for playing cricket or football during evening time. So a city or a building could have a different use. As policymakers, as urban planners, we need to think more in that direction. But definitely, there's a lot of research which is needed as of now, and it's certainly something that would take maybe 5 to 10 years to get implemented properly.
Yeah, I think definitely that
That answers the
conversion of
question.
hotels into conversion of hotels into quarantine spaces or even schools into quarantine spaces is a great alternative to especially places where you have we do not have sufficient healthcare infrastructure, hospitals. You can't have a lot of people occupying hospital beds at the same time. So I guess retrofitting, not necessarily. I feel like it doesn't have to be physically a completely different redesign of the school building itself, but it can surely be used for other purposes, such as like an emergency pop-up hospital where you just put in beds and
Yes,
the school is
yes,
obviously going to be shut down during the pandemic, so you don't really even have any other use. So you might as well use it for hospitals. So
yes.
yeah, that's
We
exactly what I was thinking.
exactly. We need to understand the distinction between redevelopment and retrofitting. So yes,
Right.
redevelopment
Right.
leads to entirely different sort of equation, but retrofitting is something that's easily achievable. Yeah.
Right. And I think as far as the construction methods that you talked about, right after that bullet point of retrofitting, I think that was maybe the way I understood it. I guess that was talking about not relying on construction materials outside your local area, like trying to use, I think in architecture, I'm forgetting that term, but there is some term for using local materials. Um, I don't know. I
Right.
can't remember that term,
So
but that's
mhm.
fair. And it is also important to note there that not only do we, should we think about using local construction methods and timber, but even the workforce, the manpower, the labor that we use for construction. A lot of the times, you talked about the migrant workers. Totally agree that they are going to rural areas in pandemic times because they want to go back home. They want to stay away from the disease, which is more obviously concentrated in big cities, so they're traveling back. But as the economy starts to reopen and construction goes back to normal, these migrants are going to come back to the city. So maybe there is some alternative way where we need to start thinking about relying on local labor and not have excessive migration of labor from coming from outside. That way we contain the situation where it's wherever it is being contained, meaning in red zone, like in India. I've heard that there is a red zone and there's yellow and so forth. So you can, if as long as that one zone is self sustainable, those people won't go, or it wouldn't have to it won't experience in migration from other areas. So I just wanted to add to this bullet point that local workforce and labor, which will make that area more self-sustainable in terms of construction, or just in general economic terms, is interesting because the big point here is why these big cities like New York, San Francisco, New Delhi, Mumbai, these are not only highly dense populated areas, but they are also global cities. People come to these cities from all over the world. So you have a tremendous exposure or vulnerability to your contraction of the disease itself, because you're in New York, there are people flying in from China, from Italy, these big epicenters, and it's hard to contain that kind of migration because you're talking about political bans, which to my surprise, the countries are putting in place a complete lockdown of the country's borders. But that kind of globalization, the interconnectedness of cities themselves, that poses a great question where should we be thinking about less globalization and then depending more on the local areas.
Yeah, that's
And then one last question: the mortality numbers, were those are at a national level, and was it out of full population, or anything something different?
yeah. So if we talk about these mortality, these are the national numbers tabulated yesterday, day before yesterday.
So mortality of coronavirus cases, like how many people are dying out
Yes,
of the detected cases? Okay,
yes.
got it. I think that's it. But very good discussion for sure.
Thank you, Tali. Thank you for your insights.
Yeah, sure. I would first like to thank Mr. Jha for being with us and indeed giving us an interesting and informative session. And I'm sure everybody is having a lot of queries. But since we are running out of time, we would like to take it up some other time. And I also want to thank all our participants today for being such a wonderful audience and making this webinar a success. And we hope you enjoyed it, and we look forward to have you back with us for our upcoming sessions. I also want to tell you that your feedback is very important for us. So please spare some time and give us your feedback on Instagram. And for if you can also email us for any queries. And I guess that is all for the day. Stay in the loop.
Thank you for inviting me over.
Thank you very much.